My name is Sherin Abdelfattah. I am a head of Rehabilitation Department in a Tareq Rehabilitation and Autism Center. Today I talking about the physiotherapy and sensory therapy with autism. First, what is autism spectrum disorders? The autism spectrum disorders, or ASD, are neurodevelopmental disorders that present with impairments in social interaction, verbal and nonverbal communication, restrictions in behavior and interests. We can see some impairments in autism or ASD. Not all autism are the same. We can see impairments in attention and social skills. We can see the skills can avoid for eye contact or looking at faces, like that. Second, we can see for impairment in language, we can see poor use of nonverbal cues such as gaze, facial expression, turn talking, and body language. Also, you can see some impairments you can see in autism or ASD, sensory modulation. This is the difficulties in regulating response sensory input, including tactile, olfactory, auditory, proprioceptive, and vestibular input. Example of some sensory modulation are a slow response to any stimulus, covering ear during any loud sound, body rocking, and arm flapping. We can see some impairments in motor, like poor limb and fine motor. This is fine motor coordination, imitation impairments, manual dexterity, and gait and balance. They have marked physical overactivity or passivity. We can see some impairments are as a praxis. What is mean of praxis? Difficulties with planning, difficulties for coordinating, executing movement and sequence. I ask a question, why the physiotherapy for children with autism? After the child is diagnosed with autism, the health professionals, which are mainly involved in addressing issues with autism, is one. Of occupational therapy, this is a team who can collect with, as a team, as a staff, with occupational therapist, psychologist, and speech therapist. But we fail to understand that these children also have underlying medical issues. Like first of these children may or may not have delay in motor development. Now, what that like? Maybe the child may learn to sit, to run, to crawling late. Then, appropriate age, the child may have less strength in few muscles. They may have less of muscle tone, which means doing activities of daily living sometimes may be difficult. Also, some movement would be difficult for this child. Now, this kind of children, the role of the physiotherapist become important because we have the therapist addresses issues of low muscle tone by giving weak muscle. Also, some movement would be difficult for these children. Now, what is the sensory integration? The sensory integration is a neurological process of how the brain receives, how the brain organized, and how the brain responds to sensory information from environment, including of sight, sound, taste, smell, touch, tactile, body position, and balance. Also, we have 5 common sense. This is a sight. This is perceiving the world through the light, color, movement, and the hearing. This is the sense of the sound and how it processes. Also, taste. detecting flavor like salt, you feeling through the cell. This is from the cell inside the mouth. And the smell, this is the receptors inside the nose. Touch, sensing pressure, sensing hot and cold. If the patient or if the child has a lack of the sensory integration, what does it mean? This is referred to the sensory processing disorders. Is a neurological condition where the brain has difficulty receiving response to sensory information from the body and the environment. This is the lack of the sensory integration. The nervous system is divided into central nervous system and the peripheral nervous system. The central nervous system is divided is the brain and the spinal cord, but peripheral nervous system is most important because divided it in motor neuron and the sensory neuron. The motor neuron take the transmission from the central nervous system to the muscle and the gland. And sensory neuron, this is transmitted from the sensory organ to the central nervous system. The nervous system is a primary responsible for the body sensory system. It consisted of the sensory nerves that transmitted the sensory information from the receptors throughout the body to the central nervous system. This is the brain and the spinal cord. The primary system, including of 5 senses I mentioned before, this is the sight, hearing, touch, taste, and smell and balance. The central nervous system is the brain and the spinal cord. This is part to receive sensory information from the sensory nerve and processed it and interpreted to it from the proprioception of the world. Mixed nerves, some nerves have the both sensory and motor function. What is the role of the nervous system in sensation? The sensory nerves, these are specialized nerves that transmitted information from the sensory receptors in the skin and internal organs in the brain and the spinal cord. For example, the sensory nerve transmitted information about the heat, about the cold, about the pain, about the pressure. Sensory receptors, this is most important. The specialized cell found in the tissue, inside the skin. The function of the sensory stimuli is surrounding environment, such as light, sound, heat, or pressure. Example of some sensory nerves, this is optical nerve, and auditory nerve, trigeminal nerve, sciatic nerve. This is some nerves of most important for the sensation. This optical nerve responsible for the sense of the sight. Auditory nerve, this is responsible of the hearing and balance. Trigeminal nerve transmitted sensation of the face. Sciatic nerve transmitted sensory and motor signals to the leg. Other sensory system is most important. This is the one, first is the balance or vestibular, proprioception and interoception. The vestibular or balance, this helps of the balance and movement. But proprioception, this is sense of your body position and movement. And the interoception, this is sense of related of internal bodily sensation, like the feeling of the hunger, the feeling of the pain. For the autism child, it's important we can do for the early intervention. The early intervention, this is the team or staff can cooperate with other. This is the team approach. This include of the pediatricians, occupational therapist, speech language pathologist, physical therapist, psychologist, applied behavior analysis, special education teacher, and social worker together. Also for the important for the family support and caregiver support. The physiotherapy and sensory therapy work together to address gross motor delay and sensory processing channel common in autism. Physiotherapy focus on improving gross motor skill, balance, coordination through the activities like jumping, climbing, while the sensory therapy uses exercise to help regulate sensory input, making in either individual to process and respond to their environment. Both physiotherapy and sensory therapy often overlap. The physical activity can be form of sensory input, and both therapists can integrate it to improve the child overall function and participation in daily life. The physiotherapy focus on aim to develop and improve of the gross motor skill, in strength, balance, and posture. This activity, including exercise as sitting, walking, more complex like jumping, crawling. Befentes improve of the physical fitnesses, help with physical development, facilitation of social engagement in sport play. This is the sensory therapy. Addresses sensory processing difficulties by helping the brain better organize and respond to sensory information. Activities incorporated of the variety of activities like swimming, different exercise, deep pressure massage to regulate the sensory input. Benefits of the sensory therapy helps to reduce sensory sensitivity and improve the sensory modulation, leading of the calmer nervous system and better regulation. This is the integrations of the post-therapist holistic approach. Therapists often work together with other professionals. This is a team, like occupational therapists, like speech therapists, to provide the comprehensive approach. What is the role of the physiotherapy? The role of the physiotherapy: improve of daily routine at home and school, develop better coordination and more stable posture, improve play skills like throwing, catching a ball with other person or other kids, develop motor imitation skills, learning by coping other action, increase fitness and stamina. This is some exercise for physical therapy. Exercise based of treatment as a treatment appropriate physical and motor skill like jumping, climbing, hand skipping, hopping, throwing, kicking, or catching a ball. This is some exercise. Children are required to perform of basic a locomotor or running, jumping. This is balance or standing on one leg. Improve play skills such as throwing or catching a ball with another person. Object control of catching, throwing, kicking. This is some exercise. Most important is hydrotherapy. The hydrotherapy like swimming, also form of exercise of the physical activity. It's hydrotherapy. The pressure and temperature of the water, like the kids quiet and can be relax the muscle. The use of the sensory therapy with children. This is the sensory therapy with children with autism. Individual assessment. The first with assessment for the child, the sensory issues, personalized for the therapy programs that includes of the variety of activities such as rocking, such as coloring, sensory games, involving of the family and the teacher to implementing the daily sensory activity to support the child progress. Implementing sensory activities. We can use activities as motor activities, tactile activities, balance activities, like motor activities such as rocking, climbing, running, jumping, this in a pulpit. Tactile activities, the finger painting, playing, play dodge, touching different surface. Balance activities, this is exercise that required balance and circle movement. Sensitivity approach, for a child with hypersensitivity and for a child for hyposensitivity. For a child with hypersensitivity, we can use for the activity to as quiet music, as soft rocking may be helpful. But for a child for hyposensitivity, the activities we can either a firm pressure, strong stimulation, brushing, or exercise like rocking, vigorous rocking may be beneficial. Community engagement. This is important. We can train for the families and teachers to implement for the sensory activities at home and school. To ensure ongoing support, create of the daily sensory program that includes of the specific activity to be participated regularly. This is some activity of sensory integration or improve of the sensory integration. We can use for this is a sensory mat, like walking on a sensory mat, or can walking or touch the hand by walking. This is can be improvement of sensory integration. So also can use for the trampoline. Also can use for the swing, rocking, or the pole. This is for calm the kids or can be relax of the muscle. This is some for the 5 sensory activity you can do at home. This is advice for parents. You can do for the sensory pin fun. This is we can bring for the rice or beans or anything you can put in the bin. Also can do for the crawling, jumping, balance, swing, rocking as used for the swing, or can do for the doge, any play by the doge squeeze and rolling some shapes. You can do some shape. Also can walking in outdoor. It's good for the child for sensory integration. Okay. Now, thank you so much.